Hi everybody, Dr. Ahles here. In this short video, we're going to talk about how you take a pulse, how you take a blood pressure, and what can go wrong with the blood pressure. So when we're talking about detecting someone's pulse, what we're actually looking at is the rate that their blood vessels are expanding and contracting. This is in response to the changes in pressure inside those blood vessels. The original pressure is coming from the heartbeat. So when we are trying to take a person's pulse, there are several particular places on the body where we have arteries that we're able to take that pulse with. So what you're probably most familiar with is using that radial artery to take the pulse. So this would be our radial pulse point. You can also take that pulse using the brachial artery, more at the brachial pulse point. Another one that you've probably are familiar with as well is using that common carotid artery to take the pulse. You can use any of these arteries that we see here. They're relatively easy to palpate. I will mention that for lab, you're going to need to be able to name these pulse points. So make sure you know what blood vessels are found in each of these regions so that you can identify the vessel that we're palpating in each of these pulse points. We also are going to measure not only the rate of contraction for our blood vessels, but we're also going to want to measure blood pressure. And if you remember from our discussion in class, pressure is something that can impact the way that blood travels through the blood vessels. When we look at that pressure, like we said in class, we have a systolic reading, which is what occurs when the heart is contracted, and we have a diastolic reading, which is what occurs when the heart is relaxed. When you think about your blood pressure, you're always seeing a higher number, the systolic number, on top, and the lower number, the diastolic number, on bottom. If you're asked to distinguish between systolic and diastolic, if we look at the average of the two of them, or the distance, in between, we call this the pulse pressure. This, again, is a term that may be important for lab, so make sure we know that the pulse pressure is the difference between the diastolic pressure and the systolic pressure. Remember that we also talked about what was called the mean arterial pressure, and that was that weird average where we count the diastolic pressure twice and the systolic pressure only once. Again, that was the mean arterial pressure on that one. If we're reading a patient's blood pressure, we're going to use a special cuff that exerts a known amount of pressure on their arm or their leg, their blood vessels, and we're going to listen with a stethoscope. What we're listening for is something called the carot cough sounds. And I want you to underline, highlight, star this, because again, this is a very important term for lab, the carot cough sounds. These are the sounds that you'll hear in a stethoscope as you slowly change the pressure in the blood pressure cuff. So the first carot cough sound that you see, or if you notice when you're getting your blood pressure taken, the first time you start to feel the pulsing in your artery, this is a representation of your systolic blood pressure. So the pressure starts out above normal. Normal, by the way, about 120/80. So the blood pressure cuff starts off higher, slowly air is released from it, slowly, until we get to a point that the pressure inside the blood vessel is higher than the pressure that's inside the cuff. That's when we'd hear that first carot cough sound, indicating the systolic pressure in the blood vessel. We'll keep feeling that pulse in our blood vessel, or they'll keep hearing sounds in the process of taking the blood pressure until we get to the last carot cough sound. The last time you hear something in the stethoscope, that's an indication of the diastolic pressure. Once we go below the diastolic pressure, you no longer hear that the sound inside the stethoscope. So the diastolic pressure, the lowest pressure, the relaxing pressure, the systolic pressure, the higher pressure when the heart is contracted. So in lab, you're actually going to use a blood pressure cuff to attempt to take the blood pressure in the brachial artery. So what you do is you set the cuff above normal pressure, so maybe 140 or above, and then you slowly use the valve that's on the side of this pump to slowly release air. So with that stethoscope on top of the brachial artery, the pressure in that cuff slowly goes down until inside that blood vessel has enough pressure to push it back. And when it's pushing, we're going to hear the pulsing, the beating inside this blood vessel, until we've dropped the pressure so low by releasing the air that we're no longer hearing that beat inside the blood vessel. So we're listening to two sounds. Remember those Korotkov sounds. The first one indicating contracted pressure, the second one indicating relaxed pressure. It's important for us to measure blood pressure because there are a couple of very common imbalances in the blood pressure system that are medically relevant. And so these imbalances, as you're probably familiar with, are called hypertension, too much pressure, or hypotension, too little pressure. For you to be diagnosed with hypertension, your values, when we listen to the Korotkov sounds, the first sound would be somewhere above the pressure of 140, and the second sound, the resting pressure, would be above 90. So hypertension, 140 over 90, or anything above that. Hypotension, the low blood pressure, is anything that is lower than 90 over 60. Again, I want to remind you that normal is about 120 over 80. So anything below 90 over 60, that's considered a low enough reading that it could be problematic for your tissues. Anything above 140 over 90 would be diagnosed as hypertension. Between 120 over 80 and this, you might have what's called pre-hypertension. So as the pressure creeps up, we're getting closer and closer to this hypertension state where it's just too high. There are multiple different reasons that the blood pressure in a person might be higher than normal. Some of those reasons are temporary. So for example, when you're exercising, your blood pressure goes up. That's going to help the blood to get everywhere through your body. Or if you're experiencing a fever or you're in an emotionally distressed state. But when we think of hypertension, we're often mostly thinking about chronic hypertension, and that has a lot more to do with some of the lifestyle factors. So for example, your diet, your age, your stress level, these kinds of things can contribute to obesity, which is a big cause of hypertension. The problem with hypertension, with blood pressure that's too high, is it makes the heart work too hard. So when the heart works too hard, ultimately it may end up failing. It can't keep working that hard. And with the blood pressure being so high, it's hard for that blood to keep moving in the way that it needs to, leading to the potential for it clotting more often. Ultimately too, high blood pressure is really hard on your blood vessels. So your blood vessels themselves might be damaged, or the tiny blood vessels in your kidneys can also be affected by this. There are a few different treatments that we use for hypertension. For the most part, they are lifestyle factors. So this is things like increasing the amount of exercise you do to train your vessels to better accommodate that pressure. And then doing things like losing weight or monitoring, changing the diet can also help with hypertension. Hypotension, we mentioned, is when the blood pressure is too low. And when the blood pressure is too low, there's a few different options for that. It might be what's called orthostatic hypotension. If you've ever felt dizzy when you suddenly stood up, you're experiencing orthostatic hypotension. Your body's not able to keep moving blood like it did before because you've suddenly changed your position. If your blood pressure is chronically low, that could be an issue with your diet, meaning you don't have everything you need. Your endocrine system may not be managing your water balance well either. It is also possible to have acute hypotension. Acute hypotension means that it came on suddenly. It kind of happened out of the blue. And when we talk about acute hypotension or circulatory shock, there are multiple reasons that we might see a abnormally low blood pressure all of a sudden. One of the ones I want to focus on with you is this one here, hypovolemic shock. In hypovolemic shock, the volume of our blood is too low. Hypo means too low. If you suddenly lose a lot of blood volume, say from an accident or an injury, your blood pressure will go down dramatically because we don't have the volume we need in those blood vessels. So hypovolemic shock, we lose a lot of blood, causing us to have a very low blood pressure. It is also possible for us to have a very low blood pressure for other reasons. So for example, when a patient's heart isn't pumping as correctly as it should, we're not getting that pressure set from the cardiac muscle contraction. We'd call that cardiogenic shock. It's an issue with the heart. Or we can have what's called obstructive shock. When we have obstructive shock, blood pressure in the body is low because there's an obstruction that's preventing blood from getting to those parts of the body. That final kind that we see here is called distributive shock. And when we talk about distributive shock, this is an issue with the way that your blood is being distributed. So blood vessels that are not supposed to be dilated or aren't supposed to be quite so big are bigger than they should be, meaning that blood isn't circulating like it should. So shock is kind of like when your system is completely out of whack. We can have blood pressure, have shock issues with our blood pressure because we lost volume, hypovolemic, because the heart's not pumping, cardiogenic, or because we have an obstruction in our blood vessels, or we're sending it to the wrong places. All of these things can lead to lower than normal blood pressure. When we think about hypotension, the biggest potential problem with this is the fact that low pressure means we're not sending as much blood to places. And if we don't send blood places, we're not going to be oxygenating our tissues like we need to. So chronic hypertension can be an issue with your cells. As long as your blood pressure is high enough to keep your blood circulating correctly, this won't be an issue. Your tissues will have what they need. But if we get too low for too long, those tissues may start to suffer because they don't have the oxygen that they need.